Top 7 tips to clear blood clots. Did you know that approximately 274 people die every day from blood clotting? That is true, and any one of us can be a potential victim. We are all vulnerable to this deadly phenomenon. Sometimes these clots can occur without any noticeable symptoms. So, what should you do in such scenarios? How should you counter and clear blood clots? Well, that is exactly what we are going to discuss, so let's start right away. Number 7. Surgical thrombectomy. The process of removing a clot from a vein or artery through surgical means is known as thrombectomy. While most clots don't require operational activities, some are deadly and hazardous enough to possibly be fatal. These can additionally cause severe damage to neighboring tissues in the body. As for the procedure itself, the surgeon initially cuts a segment of your skin right above the clot. Then, after removing the clot, he places a stent or a small tube to keep the vessel exposed. In the end, the vessel is closed and the blood flow resumes. In a study conducted on this procedure, it was found that amongst 323 patients, the success rate of the procedure was 86%, with a mortality rate of 29% after 3 months. Number 6. Home remedies. To prevent further blood clots from developing, doctors usually give patients a complete set-out plan. Although it is true that managing a clot at your home depends entirely on the severity and size of the clot, you can still take action. In fact, minor clots don't even need checkups and can sometimes go unnoticed. Current medicational plans and types of clots also make a huge difference in the possible treatment options. Your doctor's plan could involve referrals to cardiologists, neurologists, and hematologists. A compression stocking and its correct usage is often some of the things you might be recommended to use. To enhance blood flow, it is often recommended that you elevate your leg above your hip so that more blood can flow to your heart. Walking and exercising are also effective since, in essence, they speed up the flow of blood to provide more oxygen to the muscles and the heart. Another very important factor is monitoring your progress. Regular blood checks ensure that your blood is just the right consistency as it needs to be. Number 5. Compression stocking. Compression stockings can be used by an array of people other than just for blood clots. Even if you are diabetic, had your surgery, or stand for long periods of time, you can still use them. Available at any store or online, these products aid your vessels in causing blood flow. Moreover, it is an effective weapon against tiredness and achiness. In addition, they can sometimes prevent vertigo as well as help deal with the swellings on the feet. What actually happens is that if the clots form in the veins deep in your legs and arms, you can suffer from deep vein thrombosis, DVT. This can go on to evolve into post-thrombotic syndrome, which causes the vessels to swell up, tight at your feet, and loosening as you go up. The stockings help relieve this swelling by helping in pumping blood back to the heart. Number 4. Thrombolytics. Next, we have thrombolytics. While the name is fancy enough to make you think that, oh no, it's another surgical procedure, in reality, it's actually a drug. The drug can be administered either by intravenous means, where it is injected into your veins, or by catheter method, where the medicine is applied directly on the clot site. Although effective, thrombolytics are not recommended by doctors unless you have clots that are unresponsive to anticoagulant treatments and are unrealistically large in size. This is because, with the administration of medicine, you can increase the risk of bleeding tenfold. Other than that, bleeding in the brain, kidney disease, hypertension, and internal bleeding are more examples of the side effects. How do you like the video so far? Do you find it informative? If so, I would like to request you all to please subscribe to the channel and give this video a like. Share it as much as possible and hit the bell icon to receive all updates. All right, let's carry on. Number 3, prevention. In the third place, we have perhaps the most important tip you can use to clear blood clots. Remove the chances of developing one. After all, prevention is better than cure. Even the American Society of Hematology agrees with us. They have referred to blood clotting as being the most preventable blood disease in the world. Before discussing the precautions, it is worth noting that genetics play a crucial role as well. If your family has a record of blood clots, you are likely to develop these as well. But don't worry, precautions can always minimize the damage done. From wearing loose clothes to using compression stockings, quitting smoking, enhancing fluid intake, taking less sodium, there are numerous other precautions as well. Exercising, maintaining your body weight, avoiding cross legs, avoiding long periods of standing, and changing sitting position are just a few others. Number 2, vena cava filter. If you talk about the vena cava, it is one of the most essential and important veins in your body. Responsible for transmitting blood from your lower back to your heart and lungs, the vena cava is the largest vein of the human body. Thus, it also makes the movement of clots to the lungs much easier. Especially the deep vein thrombosis, DVT, in your legs can prove fatal if it blocks flow to the lungs. This condition is known as pulmonary embolism, PE. To restrict clots from traveling up, surgeons install vena cava filters. In order to do so, they make use of X-rays as they cut a segment of your neck or groin to insert the filter in your veins. This method is also usually one of the last options on the line due to the numerous risks involved. Number 1, medications. At the very top of the list, we have medications, or more specifically, anticoagulant treatment options. Due to the minimal risk and efforts involved, these are some of the safer and more effective options out there. In easy words, an anticoagulant is basically a blood thinner. More of a precautionary measure, these medications help prevent new clots while making the existing ones less fatal. Generally, these are prescribed for a week after your diagnosis to monitor results. These include unfractionated heparins, low molecular weight heparins, warfarin, and direct oral anticoagulant medications, DOACs. The DOACs are one of the most popular and latest treatment options. It has less risk than warfarins and directly attacks blood clotting proteins. The only drawbacks are the cost and regularity of these medicines. One can run into many issues if he or she is not taking the drugs consistently. Some examples include dabigatran, Pradaxa, edoxaban, Savasa, rivaroxaban, Xarelto, and apixaban, Eliquis. A little more insight into other treatments shows varied techniques to achieve essentially the same thing. Unfractionated heparins work on antithrombin, which is basically a protein that promotes blood clots. The lower molecular weight heparins, on the other hand, is just a part of UH and extends its functionality. So, which of these tips do you think works best and why? Have you ever suffered from blood clots? What was your experience? How did you manage the clot? Let us know in the comments down below. As an added reminder, if you haven't already, don't forget to subscribe to our channel and give this video a huge thumbs up. Share it as much as possible so you can potentially save someone's life. Click the bell icon for notifications on more informative content. Till next time, take care. Adios.